This morning, new research out. The annual Air Quality Life Index has just been released from the University of Chicago. And the authors are looking at the 2023 wildfire season, which was a record breaker. And it fueled Canada's worst air quality in nearly 30 years. Jennifer Yoon was here in studio earlier this morning, and she was taking us through the findings.
More than half of Canadians exposed to dangerous levels of wildfire smoke. And what that leads up to after a lifetime is, researchers say, about 2 years off of people's life expectancy. And again, what this indicates really is a reversal of progress in Canada and the U.S. Take a listen to the co-author, Michael Geestone.
Air pollution is like the zombie that we thought we had killed, but it's coming back to life. And it's coming back to life because the way we have prosecuted and tried to make improvements in air pollution have been by stopping the particles that occur when you combust fossil fuels from going into the atmosphere. But those processes and regulations don't stop CO2 from going in the atmosphere. And what the CO2 has done is it increased global temperatures, and those increased global temperatures have then set off wildfires. Which has unleashed this new form of air pollution.
That being said, the report isn't all bad news, Heather. While we saw reversals in the U.S. and Canada, globally, air pollution levels stayed about the same. And another good thing that the report points out, when people in governments have a good sense of the air quality that they're breathing in, they do take action. And they point to China, which did this and reduced their air pollution levels by about 40% in the past 11 years.
It's so interesting what you said about actually taking years off a person's life.
Yeah.
And there's been a trend towards thinking about wildfires from the health perspective. So what other things are experts saying about the health impacts of this kind of pollution?
So very intuitively, you can imagine you breathe in wildfire smoke, it affects your lungs. And when your lungs are affected, COPD, asthma, those are conditions that can happen because of air pollution and also get worse when you're breathing in air pollution. The lungs are connected to the heart too. So when you see lung problems, you see heart problems as well. And the authors say that air pollution, they believe, is the single greatest external threat to human well-being and life expectancy when you look at all the effects combined together. And I want you to take a listen to this critical care doctor who agrees that the harms are quite severe.
Poor air quality can be the same as smoking. So the risks that you have with smoking, which all of us know about, is the same as having poor air quality and us breathing it in without one.
So what's different, though, between smoking and wildfire smoke is that individuals have a choice to pick up that cigarette and light it up. When it's air quality, when it's the air you're breathing in, you don't really have much of a choice. You're either outside and breathing it in, or you can stay inside. And for a lot of people, that's not even a choice, really, right? So scientists, like those who wrote this report, are really hoping that the data they're showing will be a call to action for governments to recognize that fossil fuels can cause air pollution, not at the moment of air combust, when it gets burned and there's combustion, smoke in the air, but also with its knock-on effects. Fossil fuel burning causes CO2 levels, and then that helps cause climate change, which then makes extreme weather events like wildfires more frequent and more severe.
Jennifer Yoon, as we spoke about this new research earlier this morning in studio, let's bring in Dr. Christopher Carlston, who is an expert in this area, respirologist. He's the director of the Center for Lung Health. He's a professor, the head of the Respiratory Medicine Division at the University of British Columbia, and he is with me this morning from Bowen Island. Good morning and welcome to our program.
Good morning, Heather.
You were listening to my conversation that I had earlier with Jennifer, and I know we also shared with you these findings as have been released this morning from the University of Chicago. As you look at them, Dr. Carlston, what is your overall view? How do you characterize the findings in this new report?
Yeah, I think it was really well done. I think it's important to have it all in one place in a quality presentation like these authors did. I have to say I wasn't terribly surprised, just because I guess being in the field, we've been seeing this trend, especially with Canada being on the forefront of fires. We've been seeing this trend of a decrease in air quality over recent years. So we were aware of this. Again, kudos to the authors for putting it all together. And as I heard earlier in the opening to this, I agree that we should look at some other areas for some degree of hope, in the sense that we have seen repeatedly, including in this report, where air quality improves, it can actually not only help health in general, but actually save lives. So we simply have to continue to do everything we can to work on this problem together.
The inverse of that, I guess conversely, if you improve air quality to save lives, one of the striking numbers was the fact that breathing in poor air quality over the course of a lifetime, they've come up with the time frame for that. It can shorten life expectancy by 2 years. Was that something that was of any degree of surprise to you?
Well, again, I think this is more confirming, in the sense that we've seen numbers like that. There was a study from the U.S., and ironically, the U.S. had improved its air quality. I guess maybe ironic isn't the right word, but as far as juxtapositioning or opposing that more recent finding of loss of lives, there was a study out of the U.S. that showed a gain of lives when their air quality had improved over the years, where it was basically about traffic pollution, where we had more ability to regulate and essentially force the pollution to improve. Now fires are different, which is one of the really sobering parts of this. But again, I applaud them for putting this in those terms, because I think when we talk about years of life lost, I hope it does get people's attention.
Well, it certainly does. And as the wildfire seasons have become worse, it seems to me that we're starting to frame the whole approach as a healthcare issue, not just a property damage issue, not just an environmental issue, but a healthcare issue as well, because of the many, many implications that we're seeing, illness and implications for the healthcare system. I'm curious, as someone in your area of expertise, your specialty, what are you seeing and what have you studied that is of particular interest and concern to you at this point?
Yeah, I think that's super important. And I think the tip of the iceberg, Heather, is that when there are fire events, and heat, by the way, we're not talking as much about heat, but they tend to come together. But when there are these excursions or changes beyond the norm, we see people come to hospital, we see people come to clinic, we see people get more medications for these diseases, like was mentioned before, asthma and COPD. But I say tip of the iceberg because what we're tending to study more now, and we're recently funded by the federal government for this, is the long-term effects. So fires used to be something that happened occasionally in the summer for a brief period of time, and then we would see these events bringing people to the emergency department, to urgent care, et cetera, as I said. Now what we're concerned about, and we have increasing evidence for, is the long-term effects. So things like cancer, for example. You would never think that fire smoke could give you cancer. But as these exposures to fire smoke become not only annual every year, but they become longer and longer, so months of the year, and some people believe that they'll start to become year-round if fires tend to spread throughout the year, as they've been trending to do. Now we're getting year-long exposures, or at least several months. And that's similar to what the traffic literature has shown us for decades, that when you have these exposures year-round, essentially, or many months of the year, then we're talking about chronic disease. So not just someone with a disease that gets worse, someone that never had a disease developing something. And again, there's already evidence for as much as cancer from this, which is quite concerning.
So when you frame it in those terms, you can see why, well, you said federal government funding some research there, and people are sitting up and paying some attention. And maybe not just in Canada, because the study makes clear, and we say all the time, wildfire doesn't follow any borders. This is affecting the air quality in the United States. It's floating right across the ocean into Europe. What do you think is the best global response to this issue right now?
Yeah, certainly policies at a high level, such as those that they have at the annual COP summits that are really about climate change. As was said earlier by Michael, this is all connected to climate change. So there needs to be strong government action. But I feel really strongly now, in a way that I hadn't really previously in my career, that in the meantime, we need to equip people to be resilient and to withstand this. We can't just expect, we hope, and we should demand, but we can't wait for governments to deal with this problem and let people just suffer these diseases that I've mentioned. And so we're working really hard on understanding ways that people can protect themselves in the meantime. Thankfully, there are things that work. Air filters work. We have evidence for that. Masks work, not ideal because we don't really want people to live in a world where they have to wear masks all the time. But there are things that do work, and we are recommending them now as this problem persists. And really, for the foreseeable future, this will obviously take a very long time to turn around.
Really appreciate, Dr. Carlston, your time today. We talk about this is research from 2023, which is the worst of the wildfire seasons on record. We're living in the second worst. So these are certainly, pardon me, things that we're going to have to be contending with. And I appreciate your expert perspective on all of it today. Thanks again.
Thanks, Heather.
Dr. Christopher Carlston here on CBC Morning Live.